Our peacock question that we chose is in Black mothers, how does specific prenatal health education and promotion about complications during labor and the postpartum period compared to generalized standard education protocols during the postpartum period affect postpartum mortality within 2 weeks after discharge? And we chose this question because our research showed that Black women were 2 to 3 times more likely to die from postpartum complications than white women who had the same postpartum complications. And most of these deaths were completely preventable. These complications mostly occur due to underlying or untreated diseases or a lack of education. Our conceptual framework, evidence-based practice that we chose was the Stettler model. This has 5 phases. Our first phase was the preparation phase, where we identified the priority problem, and in our case, it was the postpartum mortality of Black mothers. Phase 2 was the validation phase, and this is where we found different levels of evidence and basically went through them. Phase 3 was the comparative evaluation phase, or our decision-making phase, which is where we determined the applicability of our evidence that we found in phase 2. Phase 3 was translation, where we determined how our research can be applied into practice or a real-life setting. And then the final stage was evaluation phase, where we measured the success of our practice change.
How we conducted our search, we started by searching the databases CINAHL, PubMed, and Cochrane. We used the keywords such as Black mothers, Black maternal health, Black motherhood, Black pregnancy, prenatal health education, antenatal education, expectant parent education, complications during labor, postpartum labor complications, risks of pregnancy, risks of delivery, postpartum mortality rate, death after childbirth, mortality, and morbidity. The search with all these keywords brought up a large bit of evidence through all the databases except for Cochrane. We were not able to find any sources there. For our inclusion criteria, we just did English language, full text availability, published within the last 10 years, and female. And our exclusion criteria was non-Black patient population, non-English, and no full text availability. So our initial search brought up 187 sources from CINAHL and 104 from PubMed. Total, there was 291 studies. And then we went through and screened them for duplicates. And there was, after that, we found 6 studies that we included. There was one retrospective comparative study, one type 1 hybrid effectiveness implementation trial, one systematic review with meta-analysis, one clinical practice guideline, and 2 qualitative studies included.
Okay, and then based on those studies, we went through and we looked through all the articles, and we wanted to make sure we understood them in full. So we went through and we found basically a very confined results section. So for the first article, that was Brewis, it was a level 3 study that found that specific prenatal and postnatal education for Black mothers could improve Black postpartum mortality rates. On a similar note, Canty in 2021, it was a level 4 study. It concluded that educating healthcare personnel and Black women that mothers are at a higher risk for postpartum complications, and that could improve the patient experience, birth outcomes, and complications. Kemet was another study we found, also published in 2021, that found that joining specialized prenatal and postnatal groups for Black women could improve mortality rates and the patient experience. Lewis concluded the same thing, that specific group prenatal education can decrease a variety of postpartum complications. Our UCA article in 2022 found that Black women are at an increased risk for severe cardiovascular maternal morbidity, specifically in comparison to white women. And that was our meta-analysis. That was our level 1 study. And it established that this inequality should be addressed in some regard. And then our clinical practice guideline was from 2017, and it was performed by the US Preventative Service Task Force. And it advised that all pregnant women should receive blood pressure measurements throughout the pregnancy in order to screen for preeclampsia and to reduce fetal complications. So that's across all populations, not just Black women. In terms of a synthesis of evidence, to be able to like narrow down what we can really take from those articles, we decided to form a table in which we went through all the articles and we were able to establish what were the main recommendations from that article. All of them were pretty generalized, and we're able to like establish that all of them had very similar themes. So those specific recommendations are specific postpartum education for Black mothers and pre-education for Black mothers. So you see that out of the 5 articles that I've included in the table, not including the clinical practice guideline, that 4 of them, the only one that did not include it, it was the one specifically focusing on cardiovascular issues. They all stated that specific prenatal and postnatal education would help if it was implemented in a clinical setting. The next one, specialized prenatal and postnatal care group for Black mothers. 2 of the articles specifically talked about this. It was specifically the Komet and Lewis articles. They specifically talked about how women who were part of these specific groups that they had studied within their articles found that they were having lower rates of morbidity or complications after the birth process. And then the last one that was found across all the articles was that informing Black mothers and healthcare personnel of the increased risks during pregnancy, that itself would decrease the risks of morbidity and birth and would help birth outcomes in Black mothers. In terms of potential practice changes, knowing that what we know, both the healthcare team and the patient have to know about the increased risk of morbidity and birth complications in Black mothers. This will just help the aiding the knowledge gap in that area. Early prenatal education for Black mothers is crucial to improving those outcomes, and suggesting that Black mothers join specific and specialized prenatal and postnatal education groups may decrease the risk for morbidity. In terms of barriers, facilitators, strengths, and limitations, some barriers that we thought of as a group could be lack of funding, lack of training in these areas. There's not a ton of specific research about this pick question. It's more like generalized research right now. So really just tuning into that specific nature of it, and just a general unwillingness to implement change. So just, it's tough sometimes to get healthcare workers to implement change when they're not getting like a pay increase, or there's not like specific classes that are like, this is super important and here's why. In terms of facilitators, there's a bunch of research opportunities in the field. Obviously, this is not a very researched area in terms of like specifics. So tapping into that research could be a facilitator. Improved patient outcomes is a big one, satisfaction, and then opportunities for organizational growth. So by using those evidence-based practice guidelines provided in the clinical practice guideline and the articles, you might be able to become like the first of your kind hospital to improve those Black morbid outcomes. Limitations, so just broad guidelines on how to effectively educate patients and implement clinical practice changes, and there's high levels of research have not yet been published. Strengths, just that the clinical significance has been identified, and the findings across all the studies were pretty consistent that if you were to implement any of these 4 changes that I've listed in the synthesis of evidence, you would see a decrease in Black morbidity rates.
In summation, we concluded that, especially from Kemet's and Lewis' study, that prenatal education in group setting is more likely to decrease the risk of morbidity due to postpartum complications. So that was a major point for us. And we realized that further research is also necessary, and we would do more randomized controlled trials, because there's not a lot of those, and systematic reviews with meta-analysis for understanding, interventions for prenatal education and maternal morbidity. And we also have evidence supporting the reason behind Black women increased in morbidity, like due to postpartum complications, and there's need for more research to improve the healthcare disparity. And throughout our research, we find that we do need to put in interventions, and this is also going to have the fundings and the barriers, and we would like other facilitators for the study as well.